All right. Well, I just want to talk to you for a few minutes about the pregnancy side of spinning babies. And you can change slide. Um, the first thing we want to look at is what is spinning babies. And let me just, so spinning babies is going to be an approach to really optimize the physical relationship between the bodies of the mother and the baby. This is going to ease childbirth. We're going to restore the balance and make room for the baby. We know that the soft tissue is going to influence baby's position, especially as we get ready to go into labor. Spinning babies adds comfort to the pregnancy and ease into the labor. Change slides. So we offer a really unique program that is activities in pregnancy, but we can carry them straight into labor. It can be used with any childbirth method that's out there, or none at all. Many people just are going to be doing our stretches and our 3 balances. The approach can be used anywhere. It can be used in the hospital, home, or an independent birth center. And when we look at the approach of spinning babies, we have to look at the old paradigm. And in the old paradigm, we looked at dilation as a sign of progress. With spinning babies, we're going to look at it as a clue. It gives us some information, but it's not going to give all the information that we need. In the old paradigm, we look at fetal position as random. Years ago, we really didn't understand the influences to the baby's position and just thought they were random. But today we know that fetal position reflects the body, the birth anatomy. And then also in the old paradigm, we believe that rotation took pressure. Pressure could be starting Pitocin or increasing Pitocin. And in our paradigm, we looked at rotation follows body balancing. And so this is why, especially the classes that will be happening here in August, we're going to be working a lot on the body balancing because we need to start every birth with the balancing activities. So the 3 principles within spinning babies will be balance, gravity, and movement. And everyone's been using gravity and movement for years. This is Gene Sutton's work out of 1996, optimal fetal positioning. And this is when we were being told we needed to be up and moving more in labor. And we all do that, even if it's sitting on a ball bedside. But sometimes we know that's not enough. And so we know that gravity and movement are going to work better if the balance is there first. And so as we start to look from the pregnancy side, and what does balance, gravity, and movement look like? Rarely is a gravity position going to be enough for a person. We need to add movement into daily life. And it's going to help increase the flexibility and reduce the pain. And then by adding balance into the soft tissue, this in turn is going to make that gravity and movement work better. So for example, we can look at the fetal compass, and we know our babies are going to go into many different positions during the pregnancy. And if you take, for example, a mom that is very athletic, she has tight abs, tight pelvic floor. If we don't add that balance, what can happen is it causes a sharper angle for that baby to enter into the pelvis. That angle is going to be very different between the lower lumbar and the inlet to the pelvis, which in turn can create the OP position. Another example is a tight psoas. Most of us do have a tight psoas. Basically, if you drive a car, you have one side tighter than the other. But what that does to the pregnant body is it can keep that baby high. And so not only high at the end of the pregnancy when we're expecting those babies to drop a little bit further into the pelvis, but also during the labor process. So this is in turn why the balancing activities are going to be so important. So when we start to look at stretching before we get to balancing, we have to be able to incorporate both into the pregnancy. So Spinning Babies has a resource called the Daily Essentials. And this is a digital download that people can get from our website. And it's going to offer daily exercises. Some are weekly exercises. It will talk about rest smart positions for both pregnancy and labor. And then there's going to be 2 one-hour yoga routines done by Bluma. And so when we think about people's lives today, sometimes they can't afford yoga classes or they don't have time to fit it into their schedules. And these yoga classes they can do during their pregnancy and postpartum. So I want to take a few minutes here and just look at why some of these daily exercises are so important. So if we talk about calf stretches for a moment, many of us have done a calf stretch. We have done a calf stretch where we put our foot up against the wall, but we change it up a little bit because we want to really make sure we are lengthening the hamstring. And so you can see from the example here, we can use a rolled up yoga mat in the hospital setting. If we need to use these as an assessment tool, we'll roll up a blanket or something. But basically the instructions are on here, but I think the key point is really making sure that heel is grounded into the floor. There's a slight bend to the knee, and we just want to lean into this. The important part of isolating the hamstring will be bringing that other foot forward. So you're going to bring it forward, which is a little bit different than how we would do a normal calf stretch. Next slide. The next stretch we want to look at is the psoas lengthener, and this we call a front lunge. And again, many of us have done some version of the lunge. In the pregnancy, we would recommend people do this daily to help lengthen that psoas, as we talked about. It can hold our babies up both in towards the end of the pregnancy and during the labor process. Next slide. Another one of our daily stretching is going to be squats. And I know a lot of people will cringe when they hear about doing squats. And many people will squat where they squat all the way to the floor. And we, again, change it up slightly. We're going to have a person stop about chair height or slightly lower, as you can see, and then do a full anterior tilt. And this anterior tilt is basically kicking your bum out. And what that's going to help do is lengthen that pelvic floor, also going to help build up your quads. We do always want to make sure when doing a proper squat that those knees are above the ankles, just to keep the weight balance and that we don't put so much pressure on those knees. Many people will do this position with a partner, but if a person did not have a partner, they could use even the doorknobs on a door. Next slide. And then our last one I just want to touch upon is our daily windmills. And the daily windmill is a wonderful stretch, really for anyone. For the pregnancy, it's going to help open up the whole entire abdominal cavity, but it really will address the piriformis. And many people within their pregnancy suffer from sciatica. And the daily windmill is going to help give a nice overall stretch to the entire piriformis. Slide. So if you've been to our website, you've actually probably seen this drawing. It's a drawing Gail did many years ago to really show us how babies come into the pelvis. And we can see with the anterior baby that we would have everything we would expect. Nice flexion, nice molding, really nice curved fetal back that's reflected in the maternal belly, a cervix that's anterior, and we have good application of the head on the cervix. And then when we look at the posterior baby, we can see that we really don't have flexion or molding. Those limbs are out further. The cervix is still posterior and not good application on the cervix. But what I really want to point out in this picture is in the posterior baby, you can see how it's been brought forward towards the pubic bone. Now we know most people with a posterior baby have some degree of back pain. And we were taught years ago that was because the baby's head was coming down along the sacrum, when in fact, many posterior babies are brought up towards the pubic bone. And so again, this is looking at the soft tissues. And it's so important that we are prepping these soft tissues during the pregnancy. So in labor, we're less likely to have a malposition. Next slide. So as I said before, we used to think babies' positions were random. But we do know today many of the influences. And some of this is, we're going to talk about much deeper into the classes at the end of the month, but it could be right obliquity. We know muscle tone and symmetry of the ligaments are going to have a huge impact. It could be the amount of amniotic fluid, location of the placenta, pelvic shapes. And really a lot of babies' positioning is our modern lifestyle living in gravity. Slide. And lifestyle has been a huge intervention in our lives that we haven't really thought about a lot. And so when we think about the pregnancy and the things that we can do to help really address this intervention. So just a few quick examples here. The first documentation we have of really looking at baby's position in the pregnancy versus lifestyle started in the early 70s. And we had a lot of things changing in the 70s. Um, one of them is that we introduced Lazy Boy. And we took people out of very linear furniture and we put them in recliners and overstuffed couches. And we had them sitting back on their sacrum more. Another one we saw happening is the first time in history at that point, we saw the most women go into the workforce. And many times it was office jobs. And if you think of people's lives in the 50s and 60s and their pregnancies, they were upright and moving all day long. And it's not that they still weren't busy in the 70s, but we had them sitting in office chairs 4, 6, 8 hours a day. Another factor is people that wear high heels every day to work. If a person wears the same 3-inch high heel every single day to work, what they do is shorten their hamstring. That in turn shifts our pelvis back and changes how a baby would engage at the beginning of labor. Another one is how long does a person sit in their car each day? Reality for many people can be up to upwards of an hour because of distance or traffic. And back in the 70s, we put bucket seats into cars, and again, meant to scoop you right under on your sacrum. And then a more recent study done a few years ago looked at the use of cell phones. And they were looking at the age people got cell phones. And today, it's common 10, 11, and 12-year-olds are getting their first cell phone. And so rarely are people standing in the proper position, body position, when they're texting or playing a game. Everybody's kind of slouched over. And what they found was that by the time these people became childbearing years, the pelvis was already held different in their body. Next slide. And so to look at what all this means is we have to look at the entire abdominal cavity and realize that we want to address all of this throughout the pregnancy. And so I know we focus a lot on up front. We've got the baby sitting up front, eventually contractions will be happening up front. But just realize when we're talking about stretching and balancing in the pregnancy, we do need to look at the top, the bottom, the front, the back, and the sides as all abdominal spacing. And we want that spacing all available throughout the pregnancy. Next slide. Now, another thing we wanted to consider throughout their pregnancy is rest smart positions. And the first thing we talk about and think about is how a person sits. And we want them sitting up on those sits bones, those, the bones that we make us sit up straight and tall. Rarely do we do that. We're usually sitting back on our sacrum more. Now, in turn, if you're sitting up properly, your knees will be at a 90-degree angle or lower than the hips. And a great example of this is the use of birth balls. And so many people at home in their pregnancy will sit on a birth ball, and they're not usually inflated properly. And so when they sink in, the knees go higher than the hips. And again, that's going to change baby's position because what has happened now is the sacrum is the lowest part of the pelvis, and the largest part of the baby physiologically will be that baby's head, and it's going to rotate back towards the sacrum. Another position we want to consider as a rest smart position will be just lying down. And if you sleep with a pillow between your knees, you want to make sure you also have one between your ankles. This is going to keep alignment of the lower spine. In pregnancy with the extra elastins throughout the system, this can cause strain on that lower back. So want to go into just briefly here the 3 balances. And this is a core part of spinning babies. This is what we're known for, is to bring balance to the entire abdominal cavity. So our 3 balances can start anywhere from 20 to 24 weeks on, and we will carry it all the way through the labor process. People will be told that they can do these daily or weekly. We know on average, most people will do these 3 to 4 times a week. And the three balances will be our jiggle, the forward leaning inversion, and the sideline release. Now with the jiggle, just some facts or some what it's going to do for the body. In the pregnancy, definitely it's going to bring calm. We will be tapping into the parasympathetic nervous system. It will increase hydration and circulation to the fascia. It will improve joint function. It's going to help mobilize that sacrum. It will open the posterior pelvis. And in labor, if needed, we can use the jiggle to directly activate the sacral tuberous and the sacral spinous ligaments. In turn, what this will do is help babies descend into the pelvis. Our next balancing activity is going to be our forward leaning inversion. And inversions are a wonderful way to address the uterosacral ligaments. They will also address the round ligaments. We know that people that do at least 1 to 2 inversions per week throughout the pregnancy have less aches and pains throughout their pregnancy because you're addressing those two main ligaments. Now, the uterosacral ligaments start at the posterior cervix. They are going to come out, they attach into the fascia of the sacrum, and they are the two main stabilizing ligaments for the torsion of the lower segment of the uterus. Many people have some degree of a torsion throughout their pregnancy because the quickest way to put one in is crossing your legs while you're pregnant. So I'm always looking for that person. If do they have an office job? Do they sit with their legs crossed? There's going to be a higher risk of a torsion. Medical definition of a torsion is anything that's greater than 45 degrees on the long axis of the uterus. And so what that creates then in the labor side is a failure to descend or a failure to progress. Now, many of you I know already know this position. This is our sideline release. We use this throughout the pregnancy to bring a nice general overall stretch to the pelvic region. We also use this in labor as one of our mid-pelvis solutions. Sideline release at home. Some key things we want people to be aware of is just making sure the head and the spine are straight. Those shoulders are stacked one above the other. The hip is also stacked. The bottom leg needs to be as straight as it can with the foot flexed. And that top leg is going to hang over in a very relaxed manner. This is going to help, as I said, that overall stretch, but primarily it will address the uterosacral, it's going to address the sacrum, the IS joints, or the SI joints, and it will also help lengthen the pelvic floor. And if we have a more lengthened pelvic floor, when we get to labor, it's going to help with our rotations, especially through mid-pelvis. Now, I wanted to be able to give you all the resources, or hopefully I hit most of them, on the Spinning Babies website. And many people, especially staff, are just referring people to the website. But some of the things, so you're aware, that can be found there is a week-by-week guide. We have exercising for the pelvic floor. There is a labor checklist. There is a large belly mapping section where people can map where their baby is located. They also can go online. We do have parent educators. So my job is more of training professionals, but we have many parent educators that you can go online. If you get into our website, you can put in a zip code and find parent educators. Some are offering in-person class and some offer online classes to people. You will also find online the step-by-step instructions for the 3 balances, which do include all the contraindications for each of the positions, but it will walk them through how to do each of the 3 balances. They also can get the daily essentials and other daily activities on our website. That's just going to answer many of their questions and help them with those stretching activities. So Spinning Babies really is a new paradigm. This is a new view on how we look at childbirth. It's not a circuit. It's not a method. It is really using the physiological side to help really ease birth. People that have included balance within the pregnancy side, we have found, and it's been proven, that the labors are easier. We have less complications. We know we can lower C-section rates, improve patient satisfaction, improve staff satisfaction. We also have looked and know that there's less hemorrhage, less 3rd and 4th degree lacerations. So spinning babies as this new paradigm is really addressing the soft tissue of the mother's body and how that influences our baby's position. In turn, it's how we're changing birth on Earth. In 2015, just to kind of wrap this up, ACOG came out with the statement that we needed to find a safe reduction for our primary C-section rates. The statement was reconfirmed last year and has been made a world mandate. And so much of addressing this is going to start in the pregnancy. As people start to look at their body positions, understanding how the soft tissue affects that baby's position, we're also creating space for the baby to do what it needs to do. And when we look at the space, especially as we go into the labor process, this space is going to help with our rotation, with our descent, with flexion. So it's so important that they're getting the information in their pregnancies so we can go on then to really do what ACOG stated and really reduce our primary C-section rates. So thank you, everyone.
Thank you, Tammy. That was great. So Tammy is traveling because she's teaching. So if anybody has any questions for her, feel free to come off mute and ask, or you can add questions to the chat if that works easier for you. One of the things I was kind of curious about, Tammy, is do you know of any, how hospitals or systems are delivering the message about spinning babies to their prenatal patients, or examples of how that has worked?
Yeah, there's been several examples. So everyone that will be attending the class here later this month, you will be getting a PDF that is going to be the 3 balances that we talked about. And the way we are seeing that used is you can make as many copies of that as you want and keep in triage. So many people come into the hospital setting throughout their pregnancy for testing or aches and pains. And I will be giving you ways to show the 3 balances within basically 3 minutes. And there's your take home basically with that PDF. And we know that people that are doing these throughout their pregnancy in turn typically have easier labors. So that is one way. Another way will be if getting that PDF even into your provider's offices. There's usually, some kind of packet a person receives from their provider. And if one of those is the PDF of the 3 balances, it will get them to the website, let them go over all the contraindication, any medical issues, and teach them step by step how to do the 3 balances. So those would be the 2 primary ways, is having those in triage, and then also possibly having your providers be able to hand those out. Also letting staff, or if any marketing that the hospital does, including in there that the staff has been spinning babies trained. People look at that. So you can say that, again, anytime the spinning baby's name, the name alone draws interest. And so people will go online and they will get so much information.
Yeah, and that's great. I'm glad you mentioned that about being able to advertise that, or to mention that, like when you were thinking about marketing. And so, with our ARPQC website, we have interactive maps so patients, has a patient facing in as well as provider can click on, and that's something that we can actually once people
is that
get trained.
Open to the pregnant people to get on?
I believe so.
Okay, because if you need to, I can get you some links that you can directly add on there for you.
That would be awesome. So, all right. Does anyone else have any questions for Tammy? We so appreciate you kind of telling us a little bit more about that patient-facing side and things that our moms can do.
And for all the staff, we're going to get into all the labor side too and help with positioning for that when we're at class.
Okay. I don't see any questions in the chat, so,
Perfect. All
all
right, then
right.
I will see you guys in a couple weeks, actually.
All right. Thank you so much. Thank
My
you, Tammy.
pleasure. You take care. Have
All
a
right.
great day.
Okay. Bye-bye.